guys, it's your girl Maria. Hello student midwives and nurses. Today I'm going to talk about fetal saturation. It might help you. You will miss the lesson due to tuition, due to sickness. You can watch on my video and get to know some knowledge about fetal saturation. I have a simple diagram that I'm going to teach from it, but before I go to my diagram, what is fetal saturation? Fetal saturation, this is an intricate system that allows the fetus to get the oxygenated blood and the nutrients from maternal placenta. So let's go to my diagram. So guys, this is my simple diagram of fetal saturation. Before I start the process, let me first show you the parts so that you can get to know. This is the maternal placenta. This is the fetal liver. These two blue upper ones are the fetal lungs. I'm not good in drawing, but I hope you understand. Then this one is the fetal heart. The fetal heart is divided into two from here. This is the upper chamber and this is the lower chamber. The upper chamber has the right atrium and the left atrium. The lower chamber has the right ventricle and the left ventricle. So the process begins like this. They are telling us that oxygen and nutrients from the mother is transferred across placenta. This is the across placenta to the fetus through the umbilical cord. This is the umbilical cord, or even this one. But let's talk about this one. Is this one that the red one is the oxygenated blood. The red color you're seeing of the arrows. That is the oxygenated blood. Then the blue one is the oxygenated blood. So they're telling us oxygenated blood and the nutrients transfer to the fetus across placenta through the umbilical cord. This enriched blood flows through the umbilical vein. This is the umbilical vein to the baby's liver. This is the liver through a shunt called ductus venosus. This is the shunt. This one. This is the shunt you're seeing. Ductus. This one. This is the shunt. Ductus venosus. And they're saying little of this enriched highly oxygenated blood goes to the liver, but most of it flows through a vessel called inferior vena cava. This is the vessel they're talking about. Inferior vena cava into the upper chamber of the heart. That is the right atrium. When the blood reach right atrium, some of this blood flows through a shunt called foramen ovale. This is a shunt called foramen ovale. It's here written down. It flows into the left atrium through a shunt called foramen ovale. When it reaches left atrium, this blood continues, some of it continues and flows to the lower chamber of the heart. That is the the left ventricle. When it reaches the left ventricle, this blood flows through the large artery coming from the heart. This is the artery coming from the heart. This one. This is called ascending aorta. It flows through the ascending aorta and goes and supplies the three arteries. That is the subclavian artery, the coronary artery, and the carotid artery to supply the brain of the fetus and the upper limbs of the fetus. That is the hands, the what, Then that is how it goes. Then they are telling us deoxygenated blood and the waste products, that is from the baby's body, comes back through this vein into the right atrium. It comes back from the right atrium. When it reaches right atrium, that is the deoxygenated blood and the waste products from the fetus body. When it comes through the right atrium, it comes down. As you're seeing this arrow, it comes down into right ventricle and enters to this artery called ductus arteriosus. You're seeing it here. It enters into ductus arteriosus and flows and goes to the lungs. If it was an adult, it will go to the lung and get more oxygen and the blood can get oxygenated. But since this is a fetus, this blood is just bypassing lung. It's just going to waste time just to play in the lungs. And this flows through the ductus arteriosus, as it goes to the other side of the lung, it goes and come back through the descending aorta. This descending aorta is bringing back the used blood, the deoxygenated blood, and the waste products from the fetus back to the placenta. As it is, you're seeing it's flowing. When it reaches here, it goes from the descending aorta, it comes to the umbilical artery and goes back to the placenta to get oxygenated, and the process starts again. So it has been brief. If you have not understood, please, if you have not understood, you can comment on my video that please repeat, or if you want any other teaching about anything, the pelvis, the normal midwifery, abnormal midwifery, I'm here to help you, my sisters. You can comment as you're studying my diagram here. Thank you very much for listening.